You gently touch your senior dog's belly. Suddenly, they scream in absolute agony. You lift their lip and see something terrifying. Their gums are stained a vibrant, sickly yellow. You probably tell yourself a dangerous lie. Oh, they just ate something bad in the yard. I am here to shatter that specific illusion. As a groomer for over 20 years, I know this is a massive internal alarm bell. Let's dissect the catastrophic failure happening. Recently, a sweet senior dog visited my salon. Everything changed when I touched his lower abdomen. The poor dog cried out in immediate pain. I gently lifted his lip to investigate further. I discovered his delicate gums were bright yellow. I stopped the grooming process immediately. I sent them straight to the emergency vet. That frightening discovery likely saved his life. Vibrant yellowing is never just canine aging. It is a systemic breakdown occurring rapidly. We must understand the medical pathology here. This terrifying condition is clinical jaundice. It occurs when dangerous levels of bilirubin accumulate rapidly within the bloodstream. This excess yellow pigment heavily saturates the canine mucous membranes and delicate skin. This is not a temporary digestive upset. It points directly to advanced liver failure. Every single passing hour decreases survival rates. Delaying emergency care is a fatal mistake. What exactly drives this intense stomach pain? One primary culprit is canine cholecystitis. This is severe inflammation of the gallbladder. The gallbladder stores vital digestive bile. When inflammation strikes, normal flow stops. Bile backs up dangerously into liver tissue. This causes unimaginable internal agony. Dogs will flinch violently when touched. Relieving this internal obstruction is critical. Without treatment, the organ can rupture. You might be watching their gum color closely. But here is the most critical mistake. You are ignoring the catastrophic lethargy. Yellow gums rarely happen in total isolation. A healthy senior dog naturally sleeps more, but pathological lethargy is entirely different. They refuse to move and their eyes become dull. This sudden weakness is a massive metabolic crisis. Combine this with persistent bilious vomiting, and you have a deadly, rapidly closing window. Let's analyze that severe stomach pain further. The abdomen often feels terrifyingly hard. This indicates dangerous internal fluid accumulation. The stomach feels tight like a stretched drum. Gentle pressure causes excruciating physical pain. They adopt a hunched posture for a reason. They are instinctively protecting failing organs. A rigid abdomen signifies internal rupture risk. Furthermore, they completely lose their appetite. Prolonged fasting accelerates their decline. You cannot diagnose this with your hands alone. Immediate professional veterinary exams are vital. Vets will palpate the extremely swollen liver. Comprehensive blood panels are absolutely mandatory. They measure critical liver enzymes and bilirubin. This confirms the exact extent of organ damage. Furthermore, ultrasound imaging is required. X-rays cannot evaluate delicate gallbladder structures. Ultrasounds expose hidden bile duct obstructions. Demand a clear, three-dimensional medical picture. Treating this requires an aggressive medical approach. Vets begin with intravenous fluid therapy instantly. These fluids flush severe internal toxins rapidly. Broad-spectrum antibiotics combat the bacterial infection. Because liver failure impairs blood clotting directly, intravenous vitamin K1 injections are crucial. This stabilizes the internal organ environment. Strict adherence to the medication schedule is vital. We must halt the inflammatory cascade immediately. This provides the foundation for life-saving care. Sometimes, medical management simply isn't enough. Vets must consider complete gallbladder removal. This complex surgery is called a cholecystectomy. It physically prevents a fatal abdominal rupture. Post-recovery requires strict dietary management. You must avoid high-fat commercial pet foods completely. Fatty human scraps trigger agonizing pain instantly. A highly digestible, low-fat diet is non-negotiable. Strict dietary discipline prevents future flare-ups. This is a lifelong commitment to their survival. Stop blaming violent symptoms on a bad meal. Manage their weight to protect their gallbladder. Schedule biannual senior wellness blood tests. Collaborate with your professional groomer always. We handle their entire body and spot the signs early. If you see yellow gums, run to the emergency vet. Do not let your dog suffer in absolute silence. Be their unwavering clinical medical advocate. For more expert grooming protocols, visit PoochesHairStudio.com and Poochestips.com.